take this opportunity today to present to you, the media, the achievements and challenges faced in several of our main programs for 2016, as well as our projections for 2017. I will continue with some of the programs while Minister Cummins will continue with others. And just to give you a brief overview of our regional health services, the regional health services, as managed by the Ministry's Regional Health Services Department, which has as its objective to ensure that adequate and appropriate health care is made available to all the people of Guyana, regardless of their geographical location. The regional and district health centers and hospitals play a coordinating and support role in all 10 regions in Guyana, including the 4 regional hospitals, the 22 district hospitals, the 70 health centers, and the 32 health posts and 1 psychiatric hospital. Improving healthcare delivery. The improvement of healthcare delivery is a continuous process which is a priority for the Ministry of Public Health. And in 2016, several measures were taken by the Regional Health Services Department to improve healthcare delivery, including capacity building, human resources, communication, training, and budgetary allocation regionally. The procurement of drugs and medical supplies. All deliveries of pharmaceuticals and health products procured through the procurement unit of the ministry are made to the Supply Chain Management Complex, SCMS, the Ministry of Public Health Central Medical Stores located at Diamond, East Bank, Demerara. This new open competitive bidding process was used for the first time in January 2016 after many years of selected tendering with one supplier. The major challenges faced with this new process was the evaluation process using the line-by-line approach, which was time-consuming, with over 20 bidders participating in the process, some for the very first time. In 2016, a total of 812 items were procured, as opposed to 1,183 in 2015. This represents a 31.4% decrease. The Ministry of Public Health this year expended $1,270,437.47 on the procurement of drugs and medical supplies. Medical evacuation. The medical evacuation program is an initiative implemented for the purpose of providing efficient and safe emergence and transportation service for critically ill patients from the hinterland regions, but not limited to the hinterland regions. In 2015, a total of 185 patients who were accommodated on 142 flights at a cost of approximately $66.6 million benefited from the medical evacuation service. In 2016, a total of 255 patients benefited from the service and were accommodated on 212 flights at an approximate cost of $82.3 million, with the month of December still to be completed. Cases involve maternity complications, snake bites, malaria, gunshot wounds, and stab wounds. The increase in the number of medical evacuation in 2016 is primarily as a result of the ministry's position on the transfer of all high-risk pregnancies from the hinterland region in an effort to reduce maternal mortality and morbidity. We had some challenges in this area, and the challenges in conducting medical evacuation include the lack of preparedness of an appropriate number of test kits for the variety of cases being presented, the absence of a ready team, appropriately trained persons to escort patients at any time during the day or the night, and the lack of appropriate monitoring equipment to take on board the aircraft. Disease outbreaks. The Regional Health Services Department recorded 8 diseases outbreaks in 2016. These outbreaks were related to the varicella or chickenpox, impetigo, gastroenteritis, bronchopneumonia, and diphtheria. There were no reported deaths as a result of these outbreaks. The following are some of the main projections for the Regional Health Services Department for 2017. All regional hospital staff should be staffed by the four basic specialist care services. To review the human resource gaps, to have specialists in all regional hospitals. Equipping and upgrading of district hospitals to deliver the full suite of mandated services. All regional hospitals should have one medical superintendent and one administrator or CEO. The availability of a national biomedical service to provide effective, timely repair and maintenance to equipment. Continued deployment of medical doctors in hinterland regions, and continue monitoring the supply and transportation of medication and medical supplies to the hinterland regions. Mental health. The Mental Health Unit was formed on May 10, 2016 by the Ministry of Public Health to provide leadership in mental health and to implement a National Mental Health Action Plan 2015-2020 and the National Suicide Prevention Plan. The mental health is high on the agenda for the Ministry of Public Health, and while there is little epidemiological evidence, it has been recognized that the neuropsychiatric illness accounts for more morbidity than HIV, AIDS, tuberculosis, and malaria combined. Projections. The acquisition and submission of relevant documents pertaining to the rights of persons with disabilities in the Ministry of Public Health for advocacy for the relevant changes in the law. Monitor to ensure the existing laws and regulations regarding pesticide sales, use, and storage are being enforced. To train at least 50% of primary health care doctors in mental health gap. To increase the number of beds added to inpatient service as the GPHC psychiatric departments. Incorporate important mental health topics into health and family life education syllabus in secondary school. Launch of a national self-harm and suicide ideation substance abuse surveillance system in all the hospitals in Guyana. We move on to vector control. The mission of the Vector Control Service Unit is to improve the control of vector-borne illness throughout Guyana by implementing tools such as vector surveillance, early diagnosis and treatment, information, education, and communication, among others, in an effort to have a healthier nation. The Vector Control Services has 3 sub-programs: malaria, Aedes-borne infection in illnesses, and neglected infectious diseases. The malaria sub-program has focuses on the fight against the Anopheles mosquitoes, ranging from vector control intervention to diagnosis and treatment. In 2016, some 9,450 new cases of malaria were recorded across the 10 administrative regions, with Region 1 recording the highest number of cases. Efforts towards fighting malaria in Guyana continued in 2016 with the training of healthcare workers in malaria case management. 79 persons from Region 1, 7, and 8 were trained and is currently being trained in Region 9, and 22 healthcare workers were trained from the remaining regions of Guyana. Training of healthcare workers at the Georgetown Prison was also conducted. In an effort to heighten efforts towards the early detection of malaria, a pilot project was rolled out in 2016, which saw the training of miners in Region 8 to use malaria rapid testing kits and to administer treatment for uncomplicated cases of malaria. 96 miners were from mining areas such as Blackwater, Jumbie Creek, Mycobie, Kawanaruk were all trained, and routine distribution of long-lasting insecticide nets at public health facilities in malaria endemic regions continued in 2016 as well. The emergence of Zika in Guyana. The first case of Zika was diagnosed in January 2016, and lab-confirmed cases shows distribution in most of the 10 administrative regions, with greater incidence along the coastal regions of Guyana. There have been several approaches to the fight against Zika with interagency cooperation, both locally and internationally. Neglected infectious disease. The Neglected Infectious Disease subprogram looks at several illnesses in particular focus on improving health awareness and designing programs to facilitate the elimination in cases where it may be possible. These diseases include leishmaniasis, Chagas, lymphatic filariasis, soil-transmitted hemeltiasis, and leprosy. The main achievement of this subprogram in 2016 was the conducting of a mass drug administrative exercise which saw pill distributors going house to house to distribute the DEC and albendazole pill to protect against filaria. Maternal and Child Health. The Ministry of Public Health's Maternal and Child Health Program Department is tasked with ensuring that women, children, and family members obtain maximum health care that is necessary for their growth and development. The expanded program on immunization. This program is one of the ministry's most robust programs. The Ministry of Public Health has been able to achieve a vaccination coverage of over 90% of all antigens given to the under 5 population. In 2016, yellow fever vaccine supplied to the general public for traveling purposes increased due to the outbreak in Angola, but programs were also, with the assistance of PAHO WHO, able to effectively manage the situation. A total of 12,000 doses with over 8,000 being distributed at the National Vaccination Center were distributed at the different locations outside of the normal routine program. Among the 2016 achievement of Maternal and Child Health Department is the successful completion of the switch from trivalent oral polio vaccine to the bivalent oral polio vaccine as part of the regional endgame strategy for the eradication of wild polio virus type 2. On September 27, 2016, the American regions, of which Guyana is a part, was declared free of endemic measles, the first region to be so certified. There was an outbreak of diphtheria in neighboring Venezuela in October, but Guyana was able to prevent a cross-border outbreak. Outreach activities, as well as on-spot surveillance training for health workers, were conducted in regions 1, 7, 8, and 9, and some 1,262 doses of the vaccine against diphtheria were administered. Reproductive family health services. Contraceptive and advice on family planning is provided at all levels of the healthcare delivery system. Among achievements in reproductive family health services in 2016 is the introduction of new contraceptive method, which is known as the implant. 18 health workers were trained, including 3 consultants, 3 medics, 3 midwives, 1 GMO, and 8 residents. Other notable achievements include continued collaboration with the Ministry of Education and UNICEF to implement the water, sanitation, and hygiene, WASH, menstrual hygiene management, and a reproductive health commodity logistic management capacity building workshop. Prevention of mother-to-child transmission. The prevention of mother-to-child transmission of HIV has now become a program to eliminate mother-to-child transmission altogether. All mothers enrolling in antenatal clinics are offered the HIV test as part of their care. Rapid testing of antenatal clinic mothers is also done on the labor and postnatal wards for those mothers who did not have HIV testing done. Integrated management of childhood illness. The integrated management of childhood illness is a holistic approach to child health which involves assessment, classification, identifying the problem, treatment, follow-up, and referral of patients. Health workers are taught the basic skills at all levels of care. At least 60% of primary healthcare professionals have been trained in integrated management of childhood illness. 30 Region 4 health professionals were trained in this regard in 2016. Health science education. This division of health science education aims to provide a cadre of competent health professionals for institutional human resource sustainability. Clinical and technical training is provided for allied healthcare professionals such as pharmacy assistants, medical laboratory technicians, x-ray technicians, environmental health assistants, rehabilitation assistants, audiology practitioners, all at the Fort Street Kingston Complex Center. Training is provided for nurses through the three national schools located in Georgetown, Linden, and New Amsterdam. The division continues to focus on the development of human resources, a critical input for the functioning of the healthcare system. The key focus is on training of nurses and other allied healthcare professionals.
Now, the mission of the Adolescent Health Unit is to improve the quality of life of adolescents countrywide by providing access to services and information, thereby equipping them to make informed decisions that can positively impact their lives. So this unit, we provide adolescent-friendly health services, increasing the access and the availability of sexual reproductive health information and services to adolescents, and decreasing the incidence of teenage pregnancy. And so this year, what have we achieved? We saw the Adolescent Health Unit participating in and executing a number of activities directed towards improving the health and knowledge of our youth population. So we had a community parenting supporting group. And so this year we saw advances in the provision of healthcare services at public institutions aimed at increasing and promoting access for adolescents. One such initiative was the Community Parenting Supporting Group. This initiative targets teen mothers and their spouses in an effort to reduce the incidence of repeat teen pregnancies and decrease neonatal and maternal mortality by emphasizing the principles of safe motherhood. So in 2016, community parent supporting groups were launched at 20 health centers in regions 1, 3, 4, 7, 8, and 10, while orientation of healthcare professionals in regions 2, 5, 6, and 9 was done to prepare them for upcoming launches. Male partner involvement is stressed as being integral in reducing unwanted pregnancies and repeating pregnancies. So sessions with these groups held twice monthly were held. An important aspect of the initiative between the Ministry of Public Health and the Ministry of Education on school reintegration for the teenage mothers, as well as distribution of basic supplies for the babies. So we had adolescent wellness clinic days, and so this new initiative sought to have 1 day per week set aside for the delivery of healthcare teenagers across the nation who are both in and out of school. The overall goal is to address the myriad of health and social issues faced by the adolescents in Guyana. So the Adolescent Health and Wellness Clinic was in 2016 launched, as I mentioned before, at 12 to 20 centers. And all these centers, which spans from regions 1, 3, 4, 7, 8, and 10, are screened, the youths are screened for early detection of chronic diseases, among other services. Special emphasis placed on nutrition and healthy eating and reduction of child and adolescent obesity as well. Peer education. As adolescent unit, the unit continued with the peer education component of its work. We saw 13 peer educators-led satellite tables set up nationwide. Information on sexual and reproductive health, drug and alcohol use, HIV and other sexual transmitted infections, and other related issues were disseminated. 2 peer educating and youth empowerment trainings were conducted in regions 1 and 10, which saw 29 persons being trained, including welfare officers, community leaders, teachers, and healthcare workers. 17 healthcare professionals in all categories benefited from a 5-day adolescent orientation training aimed at targeting behavior change in the health sector in order for health professionals to be more respectful to all persons in this target group. Now, 23 adolescents living with HIV benefited from 1 sexual reproductive health workshop, which targeted timely orientation in sexuality education. With UNICEF, this was a success, and it has influenced the decision to have such workshops integrated in the program management. Sexual and reproductive health sessions continue to be held in both primary and secondary schools across the country: Korokoro Primary, Santa Mission Primary, St. Mary Secondary School. Sexual and reproductive health information was also provided to adolescents at the various South regions, including Guy Expo. Youth empowerment also formed part of our work done by the Adolescent Health Unit in 2016. 96 juvenile detainees benefited from unit collaboration with CARICOM Youth Network in October for a youth empowerment project at the New Opportunity Corps or Corps Region 7. 4 youth empowerment camps were conducted in collaboration with the Department of Culture, Youth and Sport in 4 districts in Region 10. In an effort to promote healthy lives living among adolescents, 2 fitness challenges were conducted in Regions 4 and 1 in Region 5. 15 secondary schools and 87 young people participated in these events. Promoting physical activity in schools and encouraging adolescents and young adults to exercise were the main aims of the activities. During the fitness challenge, students engaged in activities which included speed rope, skipping, overhead presses, jumping jacks, and suitable crunches. The fitness challenge was adopted as a signature event for the department, which will be held quarterly. Plans are on the way to increase number of schools participating in this event. In November this year, the first 2-day interministerial workshop was held with the Ministry of Education to address the way forward on a number of co-inventions, such as school health clubs, physical activities in schools for the reduction of childhood obesity, sexuality education, and reintegration of teenage mothers in schools. The result was the formation of an interministerial committee whose objective is to mitigate all school health related issues and co-interventions. Now, we do have challenge in this unit, and it's understaffed. And previously, before the unit was disbanded, but since we've taken up, the government has taken up the reins, it was staffed now with 12 persons. Currently, 2 sole staff working in the unit are impaired in their execution of the program, but we're trying still. So for this new year coming, the establishment of adolescent-friendly health services in the hinterland regions, especially in the friendly spaces in the dormitory and the healthcare facilities. We want to introduce adolescent antenatal clinics in regions 3 and 6. Introduction of adolescent health packages for the adolescent livings with HIV. We want to develop a school health policy. We want to re-establish of the school health clubs in regions 7, 8, and 9. We want to develop a curriculum for community resource personnel in collaboration with the Health Science Division of the Ministry, and establish the teenage pregnancy clinics countrywide. Lastly, the way how I started, talking about NCDs and our way to eat healthy, especially in time like this, in this festive season, I want to close with this last division, food and nutrition, the food policy division. This ministry is responsible for ensuring a high standard of nutrition for all age, all cycles of life. The objectives include providing general nutrition education for the populace through community nutrition programs, monitoring the national food and nutritional situation, and providing usable information for decision makers and other users in the relevant sectors. So activities will include nutrition surveillance, nutrition education, breastfeeding, education, and anemia education. Now, the Ministry of Public Health has as its vision all people of Guyana are among the healthiest people in the Caribbean and in the Americas by the year 2020. So proper nutrition plays a vital part in ensuring and this vision is realized, since its major bearing on overall physical health of the individual. So in order to improve the nutrition in the population, we must first assess what the nutrition needs of the population are and what costs these needs can be met. So this is why the nutrition surveillance is conducted to guide policy and program decisions, which will result in improved nutrition. Now, nutrient cost analysis seeks to investigate the minimal cost of the food basket required by the individual to meet his or her basic nutritional needs. So data on food prices was gathered in all the 10 administrative regions. The data obtained from regions 1, 6, 7, 8, and 9 will be used to spread awareness in Mabaruma, New Amsterdam, Bartica, Madia, Lethem via the Healthy Affordable Eating Outreach activities. Interviews were done with approximately 50 diabetics patients in Lethem to ascertain eating habits given the high prevalence of diabetes reported in the region. In-service training was conducted with 7 regional food price collectors to improve the credibility of the food prices collected in the hinterland regions. in terms of our IEC material nutrition education, as informed population will make informed choices, such as nutrition education plays a vital role in ensuring that Guyanese are aware of the nutrients their bodies require. So in 2016, 3,427 persons benefited from nutrition education activities conducted by the Food Policy Division. These beneficiaries included parents, students, teachers, community members, teenage mothers, senior citizens, police officers, and persons with workplace environment. Collaborations were done with the ministries, NGOs, FBOs, CBOs to conduct public education and community-based nutrition sessions to provide skills and knowledge in the preparation of nutritionally balanced meals for the family. Other nutrition education work conducted included deployment of nutrition officers to 20 health facilities offering antenatal and infant clinics to address issues of maternal and child health nutrition. Nutrition assessment and counseling sessions for persons living with HIV and who were considered to be high risk were also conducted. Work continued in 2016 to boost our human capacity to conduct nutrition education sessions with 31 students being trained in the nutrition education component of the Environmental Health Assistance Training course. Other trainings included 12 physiotherapy students on nutrition for athletes, 25 community health workers in basic nutrition component of the course, 14 community volunteers in diabetes signature program in Alboystown, 12 cooks from Buxton, and more in general hygiene and food preparation. Community nutrition officers and nutrition auxiliary workers also participated in training sessions in collaboration with the National AIDS Program Secretariat on medication and interaction with foods for preparation of persons living with HIV. Now this year also we saw the FAO, the Food Agriculture Organization, it's a UN organization program, with the Ministry of Public Health holding multi-stakeholder sessions in regard to food-based dietary guidelines. So 5 persons were trained to be part of this research team to conduct surveys on knowledge and use of the current food-based dietary guidelines in Guyana. Guyana revised food-based dietary guidelines will be completed in 2017 by July of that year, next year, and will be launched during the Nutrition Awareness Week activities. And so at this point in time, we have a draft new nutrition strategy being funded by UNICEF and has been compiled since the previous strategy expired in 2015. This new strategy is being reviewed internally at the Ministry of Public Health, and meeting will be done with stakeholders to review the first draft as planned for January 2017. Breastfeeding education. We have the Baby Friendly Initiative, the hospital program. Some hospitals are being certified. 2016, 11 hospitals were accredited with Baby Friendly status. Of significance is that Guyana is the only country in the Anglophone Caribbean with hospitals accredited with the Baby Friendly hospital status, one which creates immense national pride. However, complacency is not an option since there are 20 more hospitals which have to be accredited. These include Mabaruma, Legwan, Fort Wellington, Port Morant hospitals. The establishment of baby-friendly hospitals in all the regions in Guyana is the ultimate objective. Now, focus is being paid to the first 1,000 critical days of life. So from conception to the first 2 years, emphasis being focused. And so we had our acting director, Ms. Ninian Blair, who participated in a workshop developing a model of food and nutrition education for prevention of malnutrition during the first 1,000 days of life, critical days of life. And she went to Chile, and so that we have a Chilean experience which we can call upon. This project has allowed Guyana to advance work in the area of early childhood development with specific reference to improve nutrition during the first 1,000 critical days of life, from when a baby is conceived until 2 years. In 2016, a workshop targeting senior health visitors and supervisors at the district and regional levels and supporting health facility in the region was held to develop and support implementation of communication for development strategy for infant and young child feeding practice. Breastfeeding education continues and in collaboration with other agencies and programs, including the United States Peace Corps, which saw 15 persons being trained in basic breastfeeding education. They were also trained to pilot test the breastfeeding counseling guide. In 2016, sessions were held in the showing the importance of early childhood development, including nutrition for growth and development, the role of healthcare workers, infant and young child feeding. A session was marked on the marketing of breast milk substitute, as well as Sexual Offences Act was included in this program. These areas formed a part of the program to establish early childhood development and provide adolescent and sexual reproductive health services to teen mothers in Georgetown, East Bank, and East Coast, Demerara. The first cadre of 12 healthcare workers was trained in 2016. They were also introduced to breastfeeding counseling guide for pilot testing. Anemia education. In 2016, the Food Policy Division collaborated with the Regional Health Services Department and Family Health Care Services to develop and execute an implementation for the training component in the rollout of Sprinkles expansion program in the hinterland programs.